The brain-eating amoeba, scientifically known as Naegleria fowleri, is a single-celled organism that lives in warm, freshwater environments such as lakes, hot springs, and polychlorinated swimming pools. Although it is commonly found in soil and water, it is rare for it to cause harm to humans. The amoeba infects individuals when contaminated water enters the body through the nose, typically during activities such as swimming or diving. Once the amoeba enters the nasal passages, it travels up to the brain, where it causes a severe and often fatal infection known as primary amoebic meningoencephalitis (PAM). The infection process begins when Naegleria fowleri penetrates the nasal mucosa and travels through the olfactory nerve to the brain. Upon reaching the brain, the amoeba begins to destroy brain tissue, leading to symptoms such as headache, fever, nausea, vomiting, stiff neck, and seizures. As the infection progresses, neurological symptoms become more severe, and individuals can experience altered mental status, hallucinations, and coma. Unfortunately, PAM progresses rapidly, often within 5 to 7 days of infection, and the fatality rate is extremely high, with fewer than 10 documented survivors globally. The exact reason why Naegleria fowleri infects some individuals while remaining harmless to most is not entirely understood, but factors such as the person's immune system, the temperature of the water, and the amount of exposure likely play a role. The infection is extremely rare, with only a few dozen cases reported worldwide each year. However, the high fatality rate and the swift progression of the disease make it a cause for concern for public health, particularly in areas with warm, freshwater lakes or other natural water sources that may not be properly treated. Prevention primarily involves avoiding activities that could introduce contaminated water into the nose, such as submerging the head in warm fresh water or using unfiltered water in nasal rinses. It is also recommended to avoid stirring up sediment in warm lakes or hot springs where the amoeba may reside. If water does enter the nose, it is advised to avoid putting the face underwater in such environments, especially in areas where the amoeba has been detected. If symptoms of PAM appear after potential exposure to contaminated water, immediate medical attention is essential, as early treatment with antifungal or anti-amoeba medications may improve survival chances, though no definitive cure exists. In conclusion, Naegleria fowleri is a deadly pathogen that can cause primary amoebic meningoencephalitis, a severe brain infection. While the risk of contracting the infection is extremely low, it is crucial to take precautions in warm, freshwater environments to minimize exposure, as the disease progresses rapidly and is nearly always fatal once symptoms appear. Thank you for watching. We have some amazing videos coming up, so stay tuned and make sure to hit the subscribe button.